Good evening, Dr. Halberstadt. I was wondering if you could talk to us a little bit about how you approach helping people who have a little bit of weight problems.
People who have weight problems can generally fall into two categories. One group of people who are addicted to food. The other people who eat compulsively because of psychological factors. When I meet with a person, I have to make that kind of assessment, whether it's an addiction or because of psychological components. Now, let's take the addiction, for example. There are people who believe that if you like cake, more cake is better than less cake, and they eat more cake. What they fail to understand, that when taste buds are stimulated with the first bite of cake, gives the taste. After that's desire. You're eating for desire, not for taste, but you think you're eating for taste, because more is better than less. And what you create a desire, and desire is an urge, and you're not satisfied until you satisfy the urge, and that's the addiction. If it's psychological, the earliest experience a baby has is satiation. The stop point for a baby when the baby's drinking milk from a nipple, from a bottle, is when the baby is satiated. Some individuals continue to need satiation. When they eat, the end point of eating is satiation, then they feel comfortable and good. Also, eating is equated with nurturing. There are people, when they start cutting back on food, may get mildly depressed because unconsciously it means they're not being nurtured, and they can feel very depressed, even to feelings of loneliness, and that has to be addressed. So the first task when I see a person who's overweight is to determine whether it's an addiction or whether there's psychological components, and then I help them understand what's really troubling them that gives rise to eating more than they should be eating.
And does hypnosis play a role?
Hypnosis can play a role. I can reinforce some of those beliefs, particularly with the addiction, more so than psychological factors.
Great. So if someone wanted to talk a little bit more about this with you and perhaps go on a journey of weight loss, how would they reach you?
248-457-9667.
And as far as insurance?
Insurance covers it. Most insurance does.
Terrific, doctor. Thanks once again, and until our next installment.